Michael Tildesley. He's an Associate Professor of Life Sciences at the University of Warwick in the UK and an expert on infectious disease control. He's in Coventry in the UK. Thanks very much indeed for speaking to us. So we seem to be moving inevitably towards a further spike in infections and potential further lockdowns. Can anything now be done to prevent this?
Well, obviously, it is a real concern. We are starting to see a similar pattern mirrored across several countries in Europe currently, that lockdown has eased, and as it has eased, we start to see more mixing between individuals and, of course, a subsequent rise in cases. Unfortunately, it's one of the consequences of going into lockdown that, of course, you go in, protect the health services, but as you start to ease out of lockdown, you still have an awful lot of people who are still susceptible to the virus in the population. So we're probably in this cycle now that we may have to have a series of these control measures being brought in, then potentially eased again once we start to get the virus under control. So it's a concerning time, and it's a really important time where we need to hammer home the message that people need to follow the advice, follow the rules that are in place so that we don't start to see a large second wave emerging.
And what is actually behind this spike, do you think? Is it down to young people, as some people are suggesting?
Well, there certainly is a suggestion that, certainly this appears to be the case currently in the UK, that a lot of the measures that are in place have tended to protect the elderly and those that have underlying health conditions, which is why we're seeing cases rising. And that's not yet necessarily reflected in the rise in the number of deaths, because in the UK, the number of deaths is still relatively low, with suggestion that young people are tending to be mixing in higher quantities and are getting infected. There is a caveat to this that we need to be a little bit careful, because there is the potential that when young people are infected, they may pass it on to their more elderly relatives. So we need to be a little bit cautious and make sure that we do what we can to stem this rise in infections and protect the most vulnerable.
And I wanted to ask about France, which is experiencing a huge rise in cases and has brought in mandatory mask wearing in many places. Is that going to be enough, do you think, to turn the tide?
The situation in France is clearly quite concerning at the moment. We are seeing cases rising, particularly in large urban centres, which is where we unfortunately expect the virus to circulate highly. Masks, of course, the situation around masks is they can help. Certainly there is evidence to suggest that they can help to prevent droplet transmission, but, and this is the key thing, with social distancing observed. So they're not a substitute for social distancing, they are an additional measure. So it's important that people keep following the rules, keep up their good hygiene practice, and keep observing social distancing, try to stem that rising cases.
OK, Michael Tildesley from the University of Warwick, many thanks.